By definition, volunteering is giving your time for free. But what that means is you are giving your expertise, you're giving your knowledge, you're giving your effort to better a cause, whatever that cause might be. Just volunteering is just giving yourself to a cause, and that's beautiful.
For me, what I've seen as a researcher working in Cornwall across the integrated care system is there is a sort of unseen pandemic of isolation.
The overarching problem here is that volunteers are not used effectively to connect their communities with the hospitals.
And when the opportunity to apply for the Volunteering for Health grant came up, we saw that as a really good opportunity to start connecting those in hospital with those outside of hospital.
Well, volunteers are absolutely essential to the way we work in the NHS at the moment, in how we get people closer to home, and there are so many ways in which they enhance the care that we provide in the hospital.
We're always very good at sort of helping others, but we're not always very good at letting people help us. And how does it feel when you help someone? It feels great. So to be able to do that, it's really worth it.
More people volunteer in Cornwall than anywhere else in the UK. The way that people respond to requests and respond to people in trouble in Cornwall is in a collective effort. It manifests itself in togetherness and helping each other, and I think that's one of the beauties of living where we are, but one of the opportunities of programs like Volunteering for Health going forward.
I think volunteering can make a massive difference to people. I think some of the people I work with can't leave the house, and you're that one person they talk to every week, and that's massive.
They just add another level, another dimension of care, which is priceless, really.
In its purest form, this programme is about people talking with each other. So volunteers coming into hospital and talking to patients who would otherwise be alone. Through that conversation, they're going, what are your needs, and how can the voluntary sector help you?
For me, the goal really is to build more infrastructure and support for volunteers working in the health and care system, and for the health and care system to gain more confidence in working with volunteers and the local community.
And then as that person goes through the hospital system and then is discharged home, they will keep having these conversations and build up that friendship and that togetherness, and then help that person reintegrate outside.
I would love to see Volunteering for Health benefiting everyone that takes part. This not only includes the patients that take part in the programme and the volunteers that support them, but also the staff inside the hospital and in the local community settings.
Volunteers I see sat next to us side by side in our hospital, so that we can look after people in a way that enhances their lives when they leave hospital, and it looks after their whole well-being.
For me, this programme is a recognition of the work that is already happening in Cornwall to support local people. 93 applications went in for the funding for this programme, and 15 were successful, and Cornwall was one of them. And this programme offers us an opportunity to just build on that further. So we would love as many people to be part of it.